India is going through epidemics of non-communicable diseases. Nearly 65 to 70% of deaths in India is due to non-communicable diseases. The important non-communicable diseases are heart attack, next is brain stroke, high blood pressure, diabetes, cancer. So all put together accounts for nearly 60% of deaths in India. So all these diseases are premature. They occur at least 10 to 20 years earlier age compared to Western counterparts. Earlier, children used to bring parents for the treatment of all these diseases. Today, parents are bringing their middle-aged children for the treatment of stroke, heart attack, and cancer. So, heart attack and stroke alone accounts for 30% of deaths in India, and stroke is also called brain attack. So the most important aspect of treatment is we need to really give a correct treatment, appropriate treatment within the golden hour. That is within the first 3 to 6 hours of brain stroke. If you give a clot dissolving medicine called tenecteplase and 90% of the patient it gets stabilized, then they can be shifted to a nearby center where some interventions can be done where mechanically they remove the clot. This is what is called hub and spoke model. Time has really come. We need to take stroke management to the doorsteps of semi-urban and rural India hospitals, because in tier 1 cities, there are well-established neuro centers and patients have an easy access. And in the periphery, in these rural hospitals or in semi-urban hospital, the best method of managing stroke is an early diagnosis and proper triaging. And all that is required is when a patient develops some stroke symptoms like weakness of the hand, weakness of the legs, or slurring of the speech, or loss of memory. And now we can always integrate this with artificial intelligence and telemedicine services, even if experts are not available. Moment the CT scan rules out a hemorrhage or a bleeding in the brain, then such patients are suitable for giving a clot dissolving medicine called tenecteplase, which is available in most places. And this is just 1 minute injection. It is given intravenously. So hub and spoke model of stroke management should be the need of the hour, and it can be rolled out as an all India project. So we can really save lot of lives, because stroke, as you know, when somebody develops a stroke, if he lives with disabilities, residual deficits, he is a burden for himself, is a burden for the family, loss of productive hours. So he loses his independence and there will be a family dependence. So the common causes of stroke, number 1 is high blood pressure, second is diabetes, third is smoking, fourth is alcohol, and the food habits are also important. So to keep a good brain health, to maintain a good brain health, keep 5 things as low as possible. These 5 things should be as low as possible. That is, 1 is blood pressure, second is blood sugar, third is blood cholesterol, fourth is body weight and waist circumference, fifth is overambition, and overambition.